Hey, everybody. Welcome to the Kind Intel podcast, where we explore how innovative solutions and compassionate leadership are transforming healthcare operations. Join us as we talk with industry experts who are redefining efficiency, elevating patient experiences, and shaping the future of care. On today's episode, we welcome Misty Messer from the CarePoint Clinic in Snoqualmie Valley, Washington. Did I say that right? Snoqualmie?
You did. Good job.
I've been practicing. Thanks for joining me today, Misty. Before we dive in, could you give us a quick overview of your background and current role?
Sure. I fell into this work in a roundabout way, did not plan on being a nonprofit executive director. I didn't even really know that was a thing.
Mm-hmm.
I have a background in medical. I was a respiratory therapist for years in the hospital, had kids, and knew that a 12-hour shift in a hospital was not going to cut it for raising kids. So I took a break. And once they became teenagers and semi needed me less, but also needed me more, I was looking for a way to use my skills and also my passion for supporting patients, supporting families. And I love the problem solving aspect of healthcare as well. So I kind of fell into this role. It was a ministry started by our local church. My husband and I started going to that church, and one of the first people I met was the current or past executive director, and she sucked me in pretty quickly. And right away, we saw the need for becoming an independent, so that we would be able to do a little bit more of that holistic outside of a church campus care. And around the same time, we received a grant to buy a mobile clinic. So that was about 3 or 4 years ago. And since then, we have been on a super highway of speed and change and growth. That's been really interesting and exciting to be a part of, but also a little bit scary.
That's really impressive. It sounds like you hit the ground running. So you had this need in your own personal life where you wanted a change of scenery. My mom was a nurse, so I know full well what the impact those 12-hour days have got on the family. And and then you just were able to find this position at healthcare. Uh, and it sounds like as soon as you started there, and this was 3 to 4 years ago, you're able to kick that off. And how soon did the mobile care clinic come along? Was that just right off the bat as well?
No. So I started as the clinic operations manager. No one had been in that role, so
Mm-hmm.
I kind of formed it. Our executive director was 15 hours. I was 15 hours a week,
Mm-hmm.
and we built from there. We wrote that grant together and didn't expect to receive it. And once it came through, we realized that we really had to do something.
Mm-hmm.
So all of our kind of wishes and hopes and dreams of what a mobile clinic looked like became a reality, and we had to start actually planning, building. We designed the mobile
Mm-hmm.
clinic with a local company from the ground up. This was 20 late 2021, early 2022. And there was still a whole host of COVID related delays and um, workforce. So from the time when we put in our order to when we received it was about almost 2.5 years. So it was a long process of planning for this mobile clinic while still being in our tiny one room exam clinic out of the corner of this church campus. So we had to plan for this big maybe what if while still living in the confines of our reality of that time. So it was a lot of planning. I became executive director, stepped into that role about a year after I started,
Mm-hmm.
and that then we became our own nonprofit. We received that mobile clinic, and everything has changed from when I
Wow,
started 4 years ago.
that's amazing. That's amazing. So you basically helped the clinic develop and evolve quite rapidly in a short amount of time. I noticed on the website that you have a great slogan there, and that is that healthcare is a right, not a privilege. Is that something that had been started when you came about, or is that something that had been since the beginning of the clinic? And can you tell me a little bit more about how that influences how you deal with patients on a day-to-day basis?
Yeah, that was from the beginning. Our starting in that church as a ministry was the heartbeat of the mission was that we believed that every single person had a right and
Hmm.
also that they have a story and that they are able to be a part of that story. That healthcare is not something that's done to them, it's something that they are a part of. And so our goal is to empower our patients to make sure that they know that they have a right and what they can access, and also when they need to take responsibility and be a part of their own healthcare. And so that's been from the beginning. We've adjusted and changed as things in the world and culture change around us, but that is still the heartbeat is
Hmm.
we truly believe that healthcare is a right. It is not a privilege. It is not something that you should have to pay extra for. It is a right of every single person who is living and breathing.
I mean, that's a great sentiment, and I do wish that more clinics felt the same way. And in fact, when we've talked with other healthcare providers, especially in free clinics, quote, free clinics, they've said something very similar. Now, not to go off on a tangent, but I wonder, how do you feel about the larger traditional clinics like hospital networks? I may don't know the answer to this, but do you feel like they ascribe to that same message? And if not, why not? And are they able to change?
I think that's so tough because I think the larger healthcare apparatus they are on a train that is headed in a direction that it's really hard to stop.
Mhm,
I don't envy them in their requirement of fitting within the insurance confines and the governmental confines. They are required to get through their patients as fast as they
mhm,
can. They're required to bill for as much as they can. The goal is not for better health for that patient. The goal is for profit and to make sure that their bottom line shows that they're doing good.
mhm.
And so I don't see a good way for that to change in the larger apparatus. Pretty much anything that is funded by either private equity or government is going to be beholden to so many more rules and regulations, and either you kind of get in line or you fall behind.
Right. Now, if you look on the other hand, I take it that you in your clinic do not have those kind of restrictions or expectations. And so how does that free up your time then in terms of how you treat the patients?
Well, I mean, nobody's the boss of us. It's a sense of freedom that we don't have to do what someone else is saying that we need to do. We can take each patient as an individual human and
Mhm,
treat them as such.
mhm,
We are able to spend 30, 45, sometimes over an hour with a patient who has never had the opportunity to be listened to. Our goal is to make sure that we are rewriting the narrative of access to healthcare. A lot of our patients are used to an ER visit or a very quick, we're going to treat this one issue that you came in with, usually an urgent care issue. We're not going to deal with those underlying issues of chronic disease or how you're living your life or how do you really feel about some of these things. Tackling those mental health issues that often get overlooked when you have 15 minutes and you're worried about a laceration on your scalp.
mhm.
Those sort of things just can't be tackled. And so we're able to take the time, sometimes half an hour is just listening to them tell their story. And we're reading between the lines, trying to pick out what is applicable to their health. And beyond that, we're there for them. We're not there to serve our own purpose. We use all volunteer medical staff. So it is interesting to see folks who come from a hospital or a primary care office where they're used to seeing, as I heard yesterday, I saw 20 patients yesterday, my doctor told me. And she was thinking we could do so much more good. And I'm thinking, man, those patients didn't get any time. They didn't have a chance to be
Mhm.
heard. And so we are trying to be available to our patients for whatever they need. Sometimes it takes 3 appointments to actually get to the bottom of it, but our goal is not to solve the problem and send them on their way. Our goal is to create that relationship so that ultimately we're building healthier individuals and a healthier community and an all around just holistic idea of health.
So I've heard it expressed before that you're not treating the symptom, you're treating the patient, the whole patient,
Yes.
and
Yep.
so that type of focus on the patient and that type of attention must be very time consuming. So tell me about your staff structure and how you're able to support this approach.
So we are structured largely volunteer based. I am the only full time staff. I have a couple of other part time staff,
Hmm.
and the rest are volunteers. So everything from the front desk to our referral coordinator to our dental coordinator to the person who is coordinating my volunteers, they're all volunteering their time. And that includes the nurses and the doctors and the nurse practitioners who are donating their time. We try to balance making sure that they feel like their time is used wisely while also giving as much time and energy to our patients as possible. So often in our 4-hour clinic, we may have 5 to 8 patients, which doesn't look like a lot on paper. But the nice thing about a tiny free clinic out here on the eastern edges of King County outside of Seattle, we're tiny. And I know every single person. I know their faces. I know the patients who come in. And we wouldn't have that opportunity if we were just rolling through the patients as fast as possible and just treating them as a number or a disease.
And speaking of numbers, just to get a size of how many patients a sense of how many patients you do see. You say about 8 patients a 4-hour block. Would that be about 40 patients a week then?
So we're only open once or twice a week. So
Hmm.
we have our mobile clinic that is that brand new big monster. That is usually 2 to 3 times a month. We're out in the community, and then every week we're in one location. This year, we've already reached the appointment total of last year, so year on year, we're growing by at least 25 to 50%. This year, we're at, I think yesterday, 78 appointments, which is not a lot compared to some other clinics, but every free clinic is different and every community is different, the needs.
Hmm.
As the patient count grows, we're trying to grow and adapt and build our own capacity to meet that. Right now, we are full almost all the time, and we just try and fit people in where we can and build and grow as much as we can.
Yeah. Yeah. I mean, you're bringing up a great point, and the fact that you are growing, and it sounds like you've been growing and evolving so much since you came on board. But the 478 appointments this year, I assume that's a big jump from previous years. As you scale up and as you see like the benefit and the need for this type of service in the community, how do you see that? How do you see your clinic being able to support that?
Well, that's a question I get a lot,
Right.
most often from folks who don't understand how we can keep going on volunteer basis. Our funding largely comes from private donors and small grants. We don't get any government funding.
Hmm.
And so our capacity is limited by our funding and by our workforce. We try to grow those at the same time. When we can't, we have to scale back on one or the other. Our goal eventually, probably sooner rather than later, is to hopefully hire a part time provider who would be our regular mainstay provider. And then we fill in with volunteers. Right now, you can imagine most of our providers have other jobs. They're busy. They have families. They can only give usually one clinic a month and fluctuating availability. We're often constrained by our volunteer providers. So we're always looking for more, hoping for more, out in the community, trying to add to our volunteer force. But the capacity building is limited by funding and human volunteers.
Human
Yep.
resources, right. Aside from, being able to support that ever-growing capacity and need, what other challenges do you encounter on a day-to-day basis? I mean, is it very similar? We talked about traditional hospital health networks in the past earlier. Are those do you encounter some of the same challenges that they would see, like, say, scheduling, ensuring there are no-shows, follow-up appointments, that sort of thing? Can you talk a little bit about some of those challenges that you go through?
Yeah, I think even more for us with our population of patients, often we do see a lot of cancellations and no-shows because we're asking a lot of folks to take time out of their workday. They may
Mhm.
have to take the whole day off work. They may have to, take their kids out of school. We're asking a lot of them,
Right.
and we understand that sometimes it's just not possible. Healthcare often falls to one of the lowest priorities of
Mhm.
needs. And so we try to partner with like our local food bank. We're there at the food bank. So when folks come and get their food, they can also come and see us. So
Mhm.
trying to limit the barriers as much as possible because we understand that they're taking they're taking a step to come and prioritize their healthcare. Even though we are free, there's still a cost and it still tough to I mean, I know it's hard for me to make an appointment and go to my own doctor. So understanding that the flip side of that is by the time they come to us, they usually have quite a few issues. They usually have either pre-diabetes or diabetes. They've got hypertension. They have high cholesterol and we don't want to just bombard them with here's all the things you need to do. Here's all the lifestyle changes. You have to stop eating these foods. You have to change this
Mhm.
when they have they have no ability to change anything in their life. Almost everything is dictated for them based on either their requirements of their income or fear of deportation or being found. And so we try to not come in as here's all the ways you can change and fix it. Our goal is to work with them and we'll take one step at a time and say, okay, we're going to start with this one thing and then we're going to see how that goes. And we're going to see you in 2 weeks. And hopefully, as we build that relationship, they start to invest in their health as much as we are. And ultimately, the goal is that then we're tackling all of those issues over time so that they're healthier. Because if we come in hard, they're just going to leave and we're not going to see them again. And those
You're right.
issues that were all there, they're still there. And they're going to either shorten their lifespan or they're going to decrease their quality of life. And they're our neighbors, they're our friends in our community. And so we're committed to making sure that they are taken care of as well.
In the long run, right? And so it seems
Yep.
like you're taking the approach that this healthcare is more of a marathon and not a sprint, right? You want to build that
Yes.
relationship with them and get them on a course where they can own their own healthcare in a sense and be able to push it in the right direction. Now, it's great that you're taking that approach and you're setting up the mobile clinics to go out and see patients. So in a way, you're solving one of your own challenges in terms of the no-shows by if they're not going to come to you, you'll go to them. And I've noticed that the CarePoint also does multiple clinics. Now, do you do those multiple clinics in one location or are those in separate locations? And how do you coordinate a visit for, say, if a patient comes in and they want to, you finally get them into the clinic and they say, well, since I'm here, I might as well do the dental, I might as well do the wellness track, disease management. How do you coordinate that therapy, that treatment across multiple clinics?
Well, because of our limitations on volunteers, really can we do one thing at a time. Our dental clinic, we don't have a permanent space where we have a dedicated dental clinic.
Mhm.
We partner with local dentists and they offer their services in space. Usually at least twice a year, we try and do more, but you can imagine trying trying to coordinate with multiple dentists and multiple dental chairs. And so we focus those as more almost like outreach clinics. So those dental patients, we'll put them on the waiting list, we'll schedule them. Often dental goes hand in hand with health. And so while they're waiting for that dental, we'll try and tackle some of like if they have an abscess and they have an infection, well, let's focus on that while we're waiting to get you into the dentist. And so we we really are just kind of a one at a time sort of thing. We don't have a lot of ability to say, okay, well, we're gonna send you to all these different things. We have referral opportunities. We have some partners that we can send patients to. Those are a long wait. That is a process that we have to go through, applications and all of that. So it's time consuming. It takes a long time.
Mhm.
We're asking a lot of our patients who, like I said, they finally prioritize their health. They've come in and then we're saying, well, you're gonna have to wait. This is gonna be further down the road. And so just maintaining that trust relationship to keep them invested.
Right, right. I mean, it is tough that you are tackling those visits one at a time. But for those patients who have a hard time coming in the first place, for them to know that somebody like you is going to help coordinate the care at all these other clinics, that it must take a huge weight off their shoulders, right? And be really reassuring to them to know that my healthcare is, is in good hands. Like I know that Misty and her team are going to steer me the right way. They're going to help me coordinate these visits, and that's got to be a huge help to that community. Let's take a look in the future. Where do you see? Obviously, we talked about the growth of your clinic and the expanding need for it within the community. What else do you see as far as the future of your clinic, healthcare in general, healthcare in Washington State? What do you see as far as opportunities? And also, what are some of the other challenges that you see coming up on the horizon?
Well, I'll start with the good. We definitely see a growing need for that mobile clinic to be present, visible in every community on a regular basis so that we are continually growing that trust that we're going to be there next month or we're going to be there the next time you need to see the doctor. We don't just come in and then leave and then they have to come another 20 miles to see us the next time. Our goal is to be in each of these communities on a regular basis. Um, that takes time, it takes partnerships, it takes investment from the
Hmm.
community, but
Hmm.
that is ultimately our goal. That's where we see even in the next 12 to 18 months that we'll be in every single community once a month, um, meeting the needs of those folks who live there. We also I've seen a encouraging number of folks that are committed to also caring for their neighbors and caring for the community. Sometimes it can feel like we're the only ones on this nonprofit island and everybody's just going through their own lives, doing their own thing. And if it doesn't affect them, it's nothing that they need to worry about. But there are those folks who are concerned about the state of healthcare, the state of our country and what that looks like to continue to provide. So that's one of our challenges is trying to adapt to the rapidly changing rules, orders. Our state is fantastic in terms of providing and meeting public needs.
Hmm.
They can be kind of hamstrung by federal government and funding and rules. We lost a lot of patient faith when our state was required to release all of the information of Medicare patients. We're one of 5 states that doesn't require a citizenship to receive Medicare and Medicaid, and it kinda came back to bite us and to hurt our patients.
Yeah.
So, more and more, we're trying to build that trust and convince folks that we're there providing care regardless of what the world says or what government says. And like I said, we have a strong community, small but mighty, who are also committed to that and who care and they they want to do it regardless of funding or orders or anything else.
In times like this, I mean, it's great that no matter how chaotic things are outside, that there are folks like you and people at the CarePoint Clinic that are doing great things and serving the community. So, with that, Missy, I'd like to thank you for your time today. It was really great to chat with you, and I think you provided a great insight into the pre-clinic side of things at CarePoint Clinic in Snoqualmie Valley, Washington. For more information, please check out the links below. Thanks again, Missy. It was great having you today. All the
Thank you so
best.
much.